Hello, this is Dr. Chidi, and today I'm gonna talk about key things you have to know about the seasonal flu. Currently, seasonal flu it's a problem that we really need to pay very close attention to. So I'm gonna talk about what seasonal flu it's all about and what you need to know and what you need to do in regards to this issue, which is of great public health importance. So, to start with, what is seasonal flu? What's actually flu? So, flu is just an abbreviated version of a viral infection called influenza. This is a contagious respiratory illness. So, it's an illness that affects your respiratory systems. So it's popularly called flu, but the full name is influenza virus. It can affect the nose, it can affect the throat, it can affect even the lungs sometimes, depending on the severity. Flu can cause very mild, moderate, or severe illness. And in some population, some few at-risk population, it can actually lead to death, especially people that are very elderly, newborns, people that are already sick, people that have probably chronic conditions that are already fighting, or if you have any respiratory disease and you happen to have flu, you're likely going to have severe effect compared to someone that doesn't have it. So this is an illness we need to pay very close attention to. Currently, in the US, we've noticed an increased activity of this influenza virus, the seasonal flu. If you've read the news, you will notice almost all the states in America have recorded very high activity of this flu. Matter of fact, we've also recorded some casualties, unfortunately. So it's something we really have to pay very close attention to. Seasonal flu actually it's something that can happen in temperate regions. So it happens, within a particular season compared to the tropics where it can actually just happen like an epidemic. So during this time, it's very important for you to protect not just yourself, it's very important you protect your family, it's very important you protect your colleagues, it's very important you know the attitudes, you know the habits, things you can do to help limit your contracting flu. And if you've contracted flu already, things you need to do. It's very important to protect yourself against this. So if after all your precautionary measures and you still come down with flu, there are a couple of things expected of you to do. So you will limit the effect on you and also the effect on your company, your community. So but let's start with symptoms and signs of flu. So what are those specific symptoms or signs that will tell you you likely have flu? The very first sign of flu might be fever. You might suddenly start feeling like your body is hot, or you start having chills and rigors, so suddenly you know that within your body something is not sitting right. That might be a sign or symptom of flu. You can develop cough suddenly, so if you have fever in line with cough, it might be a sign you might have flu. If you have sore throat, if you have runny or stuffy nose, if your muscles and your whole body is aching you about the time you're having all these other symptoms I mentioned, chances are that you might have flu. If you also have headaches and if you feel easily tired, suddenly you notice that you have all these other symptoms, then you notice that you also feel tired. Chances are you might have flu. In some people, you can actually have even vomiting and diarrhea. And this can actually happen in elderly, people or younger kids. So vomiting and diarrhea is something that can also happen in flu. Everything I've mentioned are non-specific signs and symptoms. Everything I mentioned can also be a sign of some other infections, bacterial infections, or other viral infections. So it's very important you work with your provider to know exactly what the diagnosis is. So, what do you do if you happen to come in contact with this flu virus, if you already have the symptoms I mentioned? It's very important you stay back home. So if you're a worker or if you have some businesses that take you outside your home, when you develop these symptoms, I will advise you to stay back home so you don't spread it to other people, so you don't spread it to your co-workers, your classmates, people in your neighborhood, your churches. So just stay back home. So even when you're not feeling so ill, when you've noticed the symptoms I've mentioned, it's also very important you rest and recuperate, because resting and recuperation is part of the management of flu. So you have to rest properly. And even when you don't show all those signs, you might actually still be contagious, because flu is very contagious. So please stay back home. When you're home, make sure you do a couple of the right things. Make sure you have thermometer at home to check your temperature, and make sure you keep your eye on it. If you happen to take any fever reducer, the time you notice this, if you check your temperature, it will not give you a good reading, because the fever reducer would have caused the fever to go. So it's important you know about the symptoms I mentioned. Then you keep your eye on what you need to do. When you have flu and you stay back home, you're actually helping the public. Like I've mentioned, you're helping yourself, you're helping the public, you're helping make sure that you don't really spread this without knowing. So talk to maybe people at your work, if you have a supervisor, or if you're in school, take permission from school, or if you're in church, take permission from your pastor for a while before you go back. Make sure you recover fully before you go back. So, what are the basic things in regards to management of flu? So, the gold standard in America is Center for Disease Control and Prevention. It's popularly called CDC. So, CDC actually recommended that people who are already sick or who has very high risk of developing severe complications of flu should be treated with antiviral drugs as soon as possible. The popular antiviral drug they use now is called Tamiflu. So it's important you know this. The earlier you treat flu symptoms, the better. Matter of fact, it's better treated within the first 48 hours. Please contact your doctor to know exactly what you're supposed to do. Treatment is always effective when started immediately. So, what are the couple of things you should do personally to help make sure you get, good protection from flu? The first effective thing you must do is to have your flu shot. Take your flu vaccine. So, about this time, it's the right time to start taking your vaccine. But remember, if you've already developed the symptoms and the signs that you have flu, taking the vaccines won't do much for you. But please, as soon as you recover, it's never late to take your flu shot. In as much as flu shot will not give us 100% protection, and the effectiveness can actually fluctuate from seasons to seasons. It's always the best way to prevent influenza from spreading and from getting it. Another thing you can do is to wash your hands regularly. So, this is where you have to apply your personal hygiene. So, make sure you wash your hands regularly. Make sure you also avoid touching your face, your eyes, your nose unnecessarily, especially if you happen to be out there at work, you touch so many surfaces, then you put your hands in your eyes, mouth, nose. If you're doing that, if the surfaces you touched are contaminated, you would have introduced this viral infection directly to the surfaces I mentioned. Please, when you're sneezing, cover your mouth and nose. So when you cough or sneeze, make sure you cough and sneeze into tissue, or use your sleeve. Cover it properly and wash your hands afterwards. When you do this, the idea is to help prevent spreading of the germs to other people. Always clean and disinfect surfaces you touch frequently. Very, very important. Then, above all, drink a lot of fluids. Fluids, fluids, fluids. Eat good food. Get some rest. Take your mind and off anything that will give you stress. So, basically, that's what you need to know about seasonal flu, which I told you is just the shortened version of influenza virus. So I expect you to help make sure we reduce the disease burden in the community from seasonal flu by taking your flu shot, by keeping very good personal hygiene. If we do all this, we probably would have had a chance to contain flu issue currently. Okay, thank you so much for listening and have a good day. Bye bye.